Hi, ladies and gentlemen, it's Dr. Julian Avoa. So this begins my multi-part series on talking about breast implant illness. Now, I was asked as a general question, do I believe in breast implant illness? And as a general answer, not only do I believe in breast implant illness, I know specifically, or based on not only my experience as a cosmetic surgeon, but working with some of the best rheumatologists in the world. I happen to be in awe of Dr. Shoenfeld, who is a world-renowned superstar as far as rheumatology is concerned. He actually named the syndrome known as Autoimmune Autoinflammatory Syndrome induced by Adjuvants, where I would consider breast implant illness as a subcategory of that particular syndrome. So what is breast implant illness? Well, breast implant illness as a subcategory of Asia effect is the fact that the implant itself is a foreign body. So your body will respond to that foreign body in a number of ways. First of all, it will form a natural capsule around that, which I'll get to, capsular contracture, as a reaction, as a foreign body reaction as part of breast implant illness. And number two, we understand that it can cause systemic effects to have a foreign body in your body. So those systemic effects can start out as hair falling out, cognitive changes, brain fog, fibromyalgia, chronic fatigue syndrome, malaise, chronic pain, and of course the capsular contracture. So now that we understand that breast implant illness not only exists, but is probably a subcategory of the Asia effect, now let's talk about why this has not been really talked about too much. Now, if you're not aware, in November of 2021, the FDA required and the implant manufacturers here in the United States created and require doctors to have patients sign an informed consent talking about breast implant illness. So this is not anything to do with opinion anymore. This is actually something that's required to be talked about and signed as far as informed consent before implants are placed. Now, unfortunately, for the past 30 years when it was not talked about or actually denied as a syndrome or a problem, unfortunately, all of those women men had implants placed without their real understanding of breast implant illness. But now that we know that it actually is a syndrome, a subcategory of Asia, and we know that it's a problem, well, what do you do about it? Well, first of all, breast implant illness, along with 100 different symptoms that can be associated with it, the most common symptom is going to be the capsular contracture. Capsular contracture occurs anywhere between a few percentages up to 10 or 11%. The FDA has it listed, and the National Institutes of Health have it listed at about 10.6%. So that's 1 out of 10 women or men, if you're going to get implants, that are at risk of developing a capsular contracture where the capsule around the implant will squeeze down on that implant and try to expel it from the body as the foreign body reaction. That requires surgery to remove that implant, to remove the capsule, and you're still at a 30% chance that it will recur. So now that we understand that the most common problem is capsular contracture, well, what are we going to do about the other problems associated with it? Now that we understand that breast implant illness is a real condition, capsular contracture is the most common. Well, what are other more problematic issues related to breast implant illness? Not only does breast implant illness trigger an autoimmune reaction, but it can worsen already existing autoimmune conditions. So if you already have hypothyroidism, diabetes, hypertension, lupus, Sjogren's syndrome, Raynaud's syndrome, you're not really a good candidate for getting breast implants, and yet that was never really discussed sufficiently in the majority of cases for women and men that get implants placed. But more importantly is the next two categories of what I'm talking about. Cancer. Okay, now many of you that have been watching issues related to breast implant illness are aware of the breast implant associated anaplastic large cell lymphoma, or BIA-ALCL. But there's a new one now that has been discussed and has been talked about and published as of March of 2023 with the FDA, and that's going to be breast implant associated squamous cell carcinoma. Now, there's only about 20 reported cases so far, and this has a different type of cancer where ALCL is related to lymphoma, SCC, or squamous cell carcinoma, is associated with the capsule itself, where the epithelial cells of the capsule that form around your implant can convert into cancer. Now, why does this happen? Why is there a lymphoma problem, and why is there a squamous cell carcinoma problem? Well, what happens is that as part of the breast implant illness, your body is constantly trying to get around or get rid of this implant that it feels it to be a foreign body. And in that, it mutates certain cells in a response to breast implant illness, which affects that susceptible person. So that person will eventually develop breast implant associated ALCL, or squamous cell carcinoma. Okay, so we cannot ignore the fact that breast implant illness is a real problem. And we cannot ignore the fact that in susceptible women or men, these particular implants can lead to cancer risks, serious cancer risks. So the bottom line is this: any doctor, be it a plastic surgeon or a cosmetic surgeon, should be discussing breast implant illness and Asia effect with their patients. Not only that, they should stop downplaying the fact that this is a serious condition or potentially a serious problem. Unfortunately, referring them to specialists, except for Dr. Shoenfeld and his associates, very few doctors in the world really have a good understanding of Asia effect or even agree that it is a syndrome or a real condition. And therefore, when you get referred to a rheumatologist, hematologist, or allergist, they may not know anything about breast implant illness. So it's really important for you to do your research related to that. And more importantly, all plastic surgeons, all cosmetic surgeons should have an open door policy related to breast implant illness and Asia effect, and should, as a courtesy, professional courtesy, offer to remove breast implants under these certain conditions or when there's a foreign body reaction. That's what we do in my practice. If a patient of mine has a foreign body reaction related to her implants, I remove those implants free of charge. So I'm hoping that this will get the message out that it's not all in your head. Breast implant illness is a real problem, and it's part of the Asia effect. I'm going to continue with my discussions related to these problems and these syndromes and these cancers in future presentations, but I just wanted to get the ball rolling with this first presentation related to this subject. Thanks so much for watching. Take care.